So welcome to medication administration. I have divided the information and the learning outcomes into three different PowerPoints. This is the first one, medication administration overall. I have a second PowerPoint that you'll need to review for the non-parenteral medications, which is everything besides the injectables. And then the third one is the parenteral medications, which is your subcutaneous, your intramuscular, and your intradermal medications. Here are the learning outcomes for the entire medication administration module. In this particular PowerPoint, I will be reviewing the first learning outcome, discussing the rights of drug administration and the related professional responsibility for safe medication practice. We will be talking about the guidelines and precautions for safe medication administration, including the adverse effects of the drugs. And we will be discussing the principles of medication administration, including the medication order and how to prevent errors. Along with that, the sentinel events, and then also wrapping it up with the nursing process for safely administering medications. This is information that you have learned already as far as safe entry. It is imperative that you check the identification bracelet and validate the patient's name and date of birth and medical record numbers. So when you do that, you need to be looking at the patient's ID bracelet and looking for any allergies, allergy bracelets. You need to be asking the patient to state his or her name, as well as asking if they have allergies. Once you do that, you validate that with the medical record number, with the medication administration record, the chart, and you make sure that everything matches. Safe medication administration begins with the 3 medication checks. So when you pull the medication bottle out of the dispensing system, you read the label as it's removed from that dispensing system. Then you read the label when comparing it to your medication administration record or your MAR. That's your second check. And then the third check and the final check is reading that label again before administering the medication to the patient. The next principle for safe medication administration are following your 6 medication rights. So every time you administer a medication, you need to make sure that you, 1, have the right medication, 2, have the right patient, 3, have the right dosage of that medication, 4, have the right route in which the medication is being administered, 5, have the right time, and 6, the right reason. There are also some assessment data that falls below number 6. So do you have the right assessment data, the right documentation, and the right response to the medication? And then in addition, the patient has the right to refuse the medication and the right to be educated about the medication. And Dr. Madden goes into that in more detail on the next PowerPoint. But make sure that you are very familiar. This is second nature, your 3 medication checks and your 6 rights of medication administration, no matter what medication you're administering. I've listed out here some general guidelines for medication administration. There are 3 different categories or columns: preparation, administration, and documentation. So you always begin everything with good infection control. You wash your hands, you check for drug allergies, and that is by asking the patient as well as looking in the patient's chart. You confirm your order, you look at your medication, and you make sure that you verify that whatever you are giving is compatible. If you're giving more than 1 medication, they're compatible drugs. You do your 3 checks, your label checks, and you make sure that you're checking expirations on each of the medication. If you need to complete a drug dose calculation, you do so and you measure the medication correctly. That's all under preparing the med. Then in administration, you administer only the drugs that you have prepared. So if someone comes up to you and says, hey, I'm running to do something else, can you please give this medication? The answer is no. You will be happy to go get the medication and then administer it, but you only administer a medication that you have prepared. You identify the patient with those two identifiers, the name, the date of birth, the medical record number. You do any appropriate assessments. So that means if you're giving a medication that is going to lower insulin, lower a glucose, you check if you're giving an insulin, you're going to be checking the blood glucose prior to giving that medication, because you want to know what the patient's blood glucose is, and then you intervene and then you reevaluate. During the administration, you always want to provide patient education, and we'll be talking about that in some detail in the next couple slides. You're going to administer the medication based on the manufacturer's recommendation, and do it under the principles of infection control, discarding any syringes or any kind of medication you've not used. And again, providing personal protection using those gloves and making sure you dispense the needles appropriately. And then after you have administered the medication, you document. You never ever document that you've given the medication until you've given it. So once you have administered the medication, you're going to document the time, drug, the dose, the route, the location. And then you're going to, obviously, if there are any errors or problems, you're going to report those immediately. And you're going to document how effective that medication is. So a therapeutic effect is the desired outcome in your medication administration. So that's what you want to happen once you've administered the medication. Sometimes there are secondary undesirable effects. These can be adverse drug reactions. They can be side effects. So I want you to know the difference between these two. Side effects are unintended secondary effects. They're mild, they're predictable, and they may be tolerated based as part of the therapy. For example, morphine. Morphine is an opioid. It's a narcotic, and it's used to treat moderate to severe and chronic pain. Okay, so we know that a side effect of morphine is constipation. However, the benefit of that pain relief usually, and I say usually, outweighs the side effect of constipation, and we can manage that constipation with stool softeners or laxatives. But on the other hand, an adverse drug reaction, is something that's severe and may require us to discontinue that drug. So staying with that morphine example, morphine can cause a sudden drop in blood pressure, can cause somebody to stop breathing. These would be adverse drug reactions. That reaction does not outweigh the benefit of the pain relief, right? So I need you to know the difference in that. And when we talk a couple slides down about patient education, you're going to want to educate your patient mainly on those side effects, the unintended, mild, predictable effects. And we'll talk more about that on the next slide. But adverse events or sentinel events, this is one of the learning outcomes of this module, happen because, or can happen because of an adverse drug reaction. So the FDA defines an adverse event or a sentinel event as a life-threatening, requiring intervention to either prevent death or prevent permanent impairment, anything that may lead to death or hospitalization. There are things that are called black box warnings, and these are, again, information that we provide to the public that we as healthcare providers need to know about in our medication administration. Many times medications are pulled from the market because of these adverse events or sentinel events that occur. An allergic response or allergic effect is the immune system responding in a negative way. It interprets that drug that you've just administered as a foreign substance. The reaction can occur immediately after the patient receives the medication, or it can be delayed for hours or days after they've been receiving the medication. So symptoms that you might see with a patient who's experience an allergic reaction are things like a rash, urticaria, itching, fever. Sometimes people have GI issues with diarrhea, nausea, and vomiting. The most serious allergic reaction is called an anaphylactic reaction, also called anaphylaxis. This is very important. You need to know this. It is a life-threatening condition where the patient experiences respiratory distress. They have sudden severe bronchospasm. We just talked about that in our oxygenation lecture. So their respiratory system, they're unable to oxygenate. They have cardiovascular collapse, and it is life-threatening. The next term I want you to know about is drug tolerance. So that occurs when the body becomes accustomed to a particular drug over a period of time. A good example of this is somebody that has been maybe on high doses of a medication like morphine, a narcotic, and their body becomes used to the medication, and it takes larger doses of that drug to produce the desired effect. Toxic effect is a specific group of symptoms that are related to the drug therapy that cause organ or tissue damage and can cause death. So toxicities can occur from a cumulative effect. So if the patient has the medication over a long period of time and they're unable to excrete it, they can have toxic effects based on the medication. Okay. Idiosyncratic effect is an unusual response to a drug that can manifest itself in either over response, under response, or opposite of the expected response. So the patient is just not, that therapeutic effect that we want is not taking place. Drug interactions. So drug interactions are real important when you are providing patient education and when you're administering more than one medication at a time, which you more than likely will. You need to make sure that whatever medication you're administering does not interact negatively with other foods, other drugs that your patient is receiving. So now let's talk about the learning outcome related to medication orders. So there are different types of medication orders. There's a standing or routine order that is carried out at a specified time until it's canceled by another order. There are PRN or as needed orders, and the patient will receive that medication when it's requested or when it's required, something such as a pain medication, for example, or a nausea medication. And then there's a single or one-time order. So that is carried out only once at a specified time. So it could be a stat order, which means carry this out immediately. It could be a one-time order after surgery or one-time order before surgery, but it is only carried out once, and they'll say administer morphine times 1 now, for example. These are the components of a medication order. In order to have a complete medication order, you need these elements. So the order needs to have the patient's name and a secondary identifier, whether that's the date of birth or a medical record number. The order needs to have a date and a time in which it is written, the name of the drug to be administered, the dosage of the drug, the route by which the drug is to be administered, and then the frequency of the administration of the drug, and then the signature of the prescribing provider. A lot of times an order, if there's a PRN or as needed order, there'll be certain parameters that will need to take place. Or if it's a hypertensive medication, antihypertensive medication, where you're giving the medication to lower a blood pressure, there can be some parameters. If a systolic blood pressure is less than 100, then do not administer this medication. Or administer this pain medication, administer morphine 2 milligrams IV PRN as needed for pain greater than level 5, something like that are good examples of parameters in the medication order. So medication administration is a very important task that you will be doing, and it is one that you need to not take lightly. So, in order to minimize, obviously, when you give medication, you want to make sure that you're helping your patient and not harming them, right? But there are so many things that can go wrong in the administration of medication that you, as nurses, as nursing students, you need to make sure that you are vigilant in carrying out the safety precautions that are in place, and the 3 checks and the 6 rights. That's why we go over it and over it so much, because we do not want you to be a nurse who has a medication error. Medication safety is of the utmost importance in the healthcare system. So we'll talk a good bit about this, but you want to make sure that you are responsible for minimizing risk of harm. You want to make sure that you work on a team to administer medication safely in a high quality fashion. You'll hear a lot about culture of safety and how many times medication errors are because of system failures. So, big takeaway from this slide is you are the key. You as a nurse are the key to prevent medication errors. You need to make sure that you follow policies related to medication administration. They're there for a reason. Never, never, never do workarounds because it's going to be easier for you to administer a medication. Always do your 3 checks and always do your 6 rights of medication administration. If you hear nothing else throughout all of this module, I need you to hear that. If a medication error does take place, there are steps and processes that need to occur. So the patient's condition, whenever you give a medication, you're going to be assessing prior and assessing afterwards. You're going to be seeing or evaluating afterwards to see if the patient's condition has changed. So if there is a medication error that takes place, you will be observing the patient's condition very, very strictly, very immediately. You'll be wanting to see if they have any of those adverse reactions. Your nurse manager and the primary care provider needs to be notified immediately. We have incident reports and processes in place with risk management at the hospitals to describe the error that took place, describe what steps happened after the error, and try to figure out basically what went wrong, and try again that system approach. What went wrong in the error, and how can we prevent it in the future? This is certainly not an all-encompassing list. You possibly will see different or more medication error types, but just to give you some example, when a medication is inappropriately prescribed, if a patient got an extra dose of the medication, or if the medication was missed, if the medication was given to the wrong patient, administration of the drug by wrong route or rate, failure to give medication within the prescribed time, incorrectly preparing the drug, improperly giving the drug, and just to give you an example, I had an order. I was a brand new nurse working up at Johns Hopkins, and this was before the electronic medical records. So we had paper medication administration records, and the medication was scheduled for 2 a.m. And it was 2 p.m. when I was working, and I administered that medication. And as soon as I gave it, I realized that indeed I had given it at the wrong time. Now, thankfully, this medication was one that did not cause an adverse reaction. It was one I needed to monitor my patient more aggressively afterwards. I notified my manager, I notified the healthcare provider, and I told the patient about it. This is a great example of not doing my 3 checks and 6 rights and thus having a medication error. So these are just examples of types of medication errors. Again, not all encompassing, but gives you an idea of, if you look at this list and you think about the steps that we're trying to instill or drill into your brain, if you do your steps efficiently and effectively, then hopefully these errors will not happen. In your Taylor textbook, you will see two different tables. Table 29.1 talks about common types of drug preparations, and in 29.2, it talks about routes for administering drugs. I couldn't get a good screen capture of those, so I just decided to put it on here so you could look that up in your textbook. So let's talk about patient teaching. The very first learning outcome: discuss rights of drug administration and the related professional responsibility for safe medication practices, including infection control and client teaching. So your patient teaching, the very first learning outcome. I only have one slide on this, but it is extremely important, and we will be reviewing it a lot in lab. Please, please, please never give a medication that you don't know what that medication is for. You have to know what medication you are administering, and this means you have to know why you're giving it, you have to know the side effects, and you have to know the peak time in which that medication is going to be effective. Patients are going to ask you. You're going to give them a medication. They're going to ask you what it's for. There is nothing worse. Well, there are some other worse things, but it's really bad if they ask you what it's for and you're like, oh, no idea. I'll have to go look that up. So before you get a medication ready to administer to your patient, make sure you look it up if you do not know it. You're going to want to educate your patient on the expected outcome of the medication. So in simulation and in skills checkoffs, and when you're giving a medication, you do not need to list out every single adverse reaction that could happen. You could get anaphylaxis from this medication. That is an adverse, hopefully rare occurrence. But you should tell the patient, this is going to make you a little dizzy, or you may have, it might cause some constipation. So, and in teaching, you would then say, if this medication makes you dizzy, let's make sure you're in the bed with your side rails up, or call me before you get out of bed, or have somebody with you when you get up. Or if this medication is going to cause some constipation, you know what? Let's get you some high fiber foods, or let's get you a stool softener. So in that teaching, you need to tell them what to expect, including the side effects and how you can help that. You want to also make sure you educate patients on techniques of medication administration. So if you have a newly diagnosed diabetic who has to give themselves insulin shots when they go home, it is your responsibility as the nurse to make sure that they are aware of how to do that safely. Two other just patient teaching practices: you want to make sure that the patient knows to take only the medication that they are prescribed, not to alter the dosages unless they communicate with a physician. I have a really good friend from my old neighborhood who was on blood pressure medication, and he had lost weight, and his medication or his blood pressure was routinely lower than it had been, and he just decided to stop taking his medication because he didn't, quote, need it. We need to make sure that we are educating our patients that if you think that this medication is not working or you don't need it anymore, you need to communicate with your healthcare provider and in consultation decide what to do about that medication, whether you want to lower the dose or stop it. And then lastly, make sure that patients know not to share medications. So medications are prescribed for an individual, and they should only use that medication that is prescribed to them. Okay, so the learning outcome: apply the nursing process to safely administer medication. So remember our nursing process right here: assess, diagnose, plan, implement, and evaluate. The big pieces of this I want to make sure that you are aware of or are mindful of. You always, when administering medication safely, you will always assess your patient prior to administering it. So not only do I mean assess, make sure you have the right patient, but assess them. Let's say you're giving a bronchodilator, which you all know dilates the bronchioles to promote oxygenation. You're going to want to auscultate their lungs. You're going to want to put a pulse oximeter on their finger and assess their oxygen saturation. You're going to want to plan how you're giving that medication. So let's say you're giving a nebulizer or an inhaler. You will want to plan the process of that medication administration. You will then want to administer the medication, and then you have to evaluate. So this is huge, huge, huge. There's a big push. Joint Commission is very strict on when you give a medication, you have to assess prior and you have to evaluate after. So if you're giving a bronchodilator, you have to assess them, give the medication, and then evaluate. Did you dilate those bronchioles? If you're given a pain medication, you're going to want to assess them using that cold spot acronym. Make sure you have a severe pain number on a scale of 0 to 10. How bad is your pain? You're going to implement that medication using your 3 checks and your 6 rights, and then you're going to evaluate if it worked. So let's say my patient was an 8 on the severe pain scale. I gave my medication, let's say I gave morphine. Then I know what time I'm going to go back in 30 minutes to check, because that's when that medication is going to peak, and I'm going to evaluate my patient and make sure that their pain severity has gone from a 6 to maybe a 2 or a 3 or whatever that number is going to be. But you need to assess, implement, and then evaluate. So next you're going to want to review the medication administration non-parenteral medications. That's everything besides the injections. And then review the medication administration parenteral medications. Thank you so much for listening. And as always, let me know what questions I can answer for you.